Mediclinic Wellcare Hospital is a modern multi-speciality hospital, and in fact it's one of the oldest and most reputed hospital in Dubai. And Wellcare Hospital is one of the first hospitals to receive the prestigious Dubai Quality Appreciation Award and the International ISO 9000 certificate. The practice here, I have to say, is quite variable, but generally acceptable. Challenges, in Dubai or in UAE, people come from different nationalities, different backgrounds, different cultural beliefs, so they have different myths and beliefs regarding the management of the fever and seizures. And we as professionals, I think, try to clear those doubts, the myths, and give them the best advice based on the current evidence for the management of these children. Well, no breakthrough as such. However, the management of the children with febrile seizure keeps evolving as the new evidence and researchers start to and keeps coming in. And we professionals should try to keep pace with that. And we'll discuss all that in the conference. First of all, the correct diagnosis of febrile seizures. Although it sounds that it's very obvious, but there are lots of paroxysmal events with fever which can be misdiagnosed as febrile seizures. Secondly, the management of these children on the current evidence or current scientific evidence. And thirdly, and very importantly, to tell the parents or to counsel the parents regarding the recurrence of these seizures, how to avoid the recurrence of these seizures, and the overall prognosis. Again, we'll discuss all this and a lot more during the conference. Febrile seizure is one of the commonest acute problems encountered by the pediatrician and the nurses in the emergency all over the world. It doesn't vary from one region or one country to another. It's one of the commonest problems. And it's really important that we know how to manage these children, and more importantly, and how to manage them in day-to-day practice, and again, more importantly, how to counsel these parents who obviously are very anxious. Well, the best thing I like about International Pediatric Congress is that it involves the speakers and the facilitators who are internationally trained, but they have been or they are working locally in the Middle East, and they are in the best position to understand the problems of these families and in a better position to share their expertise and knowledge to the pediatricians or the healthcare professionals practicing in this region.